Welcome. Today is part 2 in what I plan and intend to be an ongoing series of examinations or dissections, you might say, of some pretty important documents that anyone can find on the web, and I would thoroughly encourage you to read this entire document. I'm going to be skipping through much of the document because it is almost 90 pages long and I don't want this video to go on for 3.5 hours. But this document and all of the other documents and pages that I show today are going to be linked up in the show notes, which you can find on my website, and the link will be below this video if you're watching it in YouTube or BitChute or any other format. And the reason why I'm doing this series is because the Canadian philosopher and media theorist Marshall McLuhan said that fish did not discover water. In fact, because they're completely immersed in it, they live unaware of its existence. Similarly, when a conduct is normalized by a dominant cultural environment, it becomes invisible. And the ocean of information that we're swimming in is actually invisible to us until we start to pay attention to it, until we begin to cast a critical eye upon it. And documents like this one that we're going to be dissecting today can be seen through a number of different lenses. And the primary lenses that I'm going to be looking at it through today are firstly as a piece of propaganda, and secondly as an instruction manual for propagandists, and thirdly perhaps as an example of predictive programming. Now, the term propaganda is familiar, I guess, to everyone, and we tend to delude ourselves that in Western democracies we're not subject to propaganda. That's a term that we associate with, for example, communist countries. However, the man who literally wrote the book on propaganda, Edward Bernays, who was a nephew of Sigmund Freud, a fact that is perhaps not coincidental, he essentially saw propaganda as being really, fundamental to the operation of democratic societies. And he opens his 1928 book called Propaganda with this statement, which I find very arresting. The conscious and intelligent manipulation of the organized habits and opinions of the masses is an important element in democratic society. Those who manipulate this unseen mechanism of society constitute an invisible government, which is the true ruling power of our country. He was writing in the US, but of course the same applies in Australia and the UK and European countries and really anywhere throughout the world where people believe that they're under democratic government. Bernays goes on to write, "We are governed, our minds are moulded, our tastes formed, our ideas suggested largely by men," and of course these days women as well, "we have never heard of. This is a logical result of the way in which our democratic society is organized. Vast numbers of human beings must cooperate in this manner if they are to live together as a smoothly functioning society." Now, in actual fact, Bernays kind of betrays that he thinks this is a rather inefficient way of running society, and he says in a slightly later section of this same chapter, "It might be better to have, instead of propaganda and special pleading, committees of wise men," technocrats presumably, "who would choose our rulers, dictate our conduct, private and public, and decide upon the best type of clothes for us to wear and the best kinds of foods for us to eat." That sounds like a fun society. But we have chosen, Bernays goes on to say, the opposite method, that of open competition. We must find a way to make free competition function with reasonable smoothness. To achieve this, society has consented to permit free competition to be organized by leadership and propaganda. I actually don't recall consenting to that at any stage in my life, but nonetheless, if we just go back a little, Bernays says, in theory, every citizen makes up his mind on public questions and matters of private conduct. In practice, if all men had to study for themselves the abstruse economic, political, and ethical data involved in every question, they would find it impossible to come to a conclusion about anything. We have voluntarily agreed to let an invisible government sift the data and high spot the outstanding issues so that our field of choice shall be narrowed to practical proportions. From our leaders and the media they use to reach the public, we accept the evidence and the demarcation of issues bearing upon public questions from some ethical teacher, be it a minister, a favourite essayist, or merely prevailing opinion. And I would say increasingly from scientists representing, in inverted commas, the science. We accept a standardized code of social conduct to which we conform most of the time. Again, I'm going to link up this book in the show notes, and I'd really encourage you to read it through in its entirety. It's not a particularly lengthy book, and it's really quite easy to read. And it's important to say that Edward Bernays was incredibly influential in the earlier part of the 20th century. He was known as the father of public relations in the US. If you'd like to learn more about Bernays in a pretty accessible fashion, you might like to watch The Century of the Self, a documentary series by Adam Curtis, particularly episode 2 titled The Engineering of Consent. And another really excellent treatment of Bernays and the PR people and propagandists who both preceded him and whom he inspired is in the fantastic Scott Noble documentary from a few years back now called Psy War. Well worth a watch. Now, aside from the propaganda angle of this particular document, the other lens through which to view it would be that of predictive programming. And predictive programming was identified by Alan Watt as a subtle form of psychological conditioning provided by the media to acquaint the public with planned societal changes to be implemented by our leaders. If and when these changes are put through, the public will already be familiarised with them and will accept them as natural progressions, thus lessening possible public resistance and commotion. So again, keep these two ideas, propaganda and predictive programming, in mind as we work our way through this document. Most people who have any curiosity whatsoever about what is truly happening to us in this era of SARS-CoV-2 and COVID-19 have by now heard of Event 201. And this was what's known as a tabletop exercise, simulating an outbreak of a novel zoonotic or animal-derived coronavirus. And the putative virus in this simulation was transmitted from bats to pigs to people, so both like and unlike SARS-CoV-2, which we're told was transmitted from bats through to some intermediary animal. Pangolins were first suggested, but that idea is now largely being discredited, and then on to humans. And again, this simulated virus makes the leap and becomes transmissible from person to person, leads to a severe pandemic. They note that the pathogen and the disease that it causes are modelled largely on SARS, severe acute respiratory syndrome, which emerged in 2002-2003, but is more transmissible in the community setting by people with mild symptoms. Now, Event 201 was held in October of 2019. And as we all know, just 2 months later, the first cases of a strange pneumonia emerged in Wuhan, in Hubei province in China, and then began spreading, and the rest, as we know, is history. Now, moreover, there's no possibility of a vaccine being available in the first year. There's a fictional antiviral drug that can help the sick but not significantly limits the spread of the disease. Is any of this sounding kind of familiar to you? And at the end of the exercise, they reach the point where the pandemic is beginning to slow because there are fewer and fewer susceptible people. The pandemic will continue at some rate until there is an effective vaccine, or 80 to 90% of the global population has been exposed, and from that point on, it's likely to be an endemic childhood disease. And again, we've heard exactly the same language being used in relation to SARS-CoV-2 and COVID-19. Now, the participants in Event 201 were the Johns Hopkins Bloomberg School of Public Health Center for Health Security, the World Economic Forum, and the Bill and Melinda Gates Foundation. And again, this was October 2019. This futuristic scenario for public health risk communicators was hosted solely by the Johns Hopkins Center for Health Security. And unlike Event 201, which was a full-scale tabletop exercise where lots of people from all over the world kind of jetted in to sit in a room together and watch all these, mocked up media broadcasts and run through the scenario. This is merely a written exercise. The intended audience is public health risk communicators. Public health risk communicators, who might they be? The first, obvious conclusion that you would reach is that public health risk communicators would be people in government positions, federal, state, local public health officials who need to talk to the public. But public health risk communicators, more broadly defined, also include the media and pharmaceutical companies, particularly those who are in charge of developing vaccines or treatments for epidemic diseases like COVID-19. Now, one of the important questions that we need to ask when analysing a document like this is, what is the Johns Hopkins Center for Health Security? And it turns out that Johns Hopkins has received a lot of funding, really extensive funding from Bill Gates, and Johns Hopkins has been really instrumental in providing data, statistics, maps and COVID resources, funneling those through to the White House and to public health authorities. So it's been a very important player in the current COVID-19 situation. Now, working our way through this document, the project team is headed up by Monica Schoch-Spanner, who has a PhD in anthropology, as it turns out. And if we take a look at her biography on the Johns Hopkins webpage, we can see that she is actually playing a pivotal role in the COVID-19 response, and specifically she co-chairs the working group on readying populations for COVID-19 vaccines. So the role of this panel is to develop evidence-informed, actionable recommendations on how to enhance public awareness, access to, and acceptance of SARS-CoV-2 vaccines. Now, again, she's an anthropologist. She's not a medical researcher. Her job is not to carry out any safety assessments or efficacy assessments of the vaccine. People in positions such as hers really take it as a given that any vaccine that is approved is going to be safe and effective. And so they see their job as solely to put it out there to the public. And again, this really goes back to the notions of propaganda that Bernays laid out, where people who are experts are actually making decisions on behalf of the entire population. And those experts don't necessarily know each other. So our invisible governors are, in many cases, unaware of the identity of their fellow members in the inner cabinet. The kind of world that Bernays sees and tacitly approves of is very much a technocratic society ruled by experts, and that expertise is very compartmentalized. So in a world led by experts, experts in one particular field don't actually see it as part of their responsibility to assess all of the data. So someone like Dr. Schoch-Spanner would not see it as being within her ambit to actually look at safety and efficacy data of the vaccines. Her sole role in this whole enterprise is to convince the public to actually take up the vaccine. And again, bear that in mind as we work our way through this document and the various scenarios and situations that it goes through. This document was published, so the whole exercise was held and then written up in October 2017. So this is toward the end of the first year of the Trump presidency, a point that will become important, and we'll come back to that. And as we move on through the document, let's just skip through the boring bits and enlarge it to make it easier to see. So the first step in the planning of this scenario was to select a time period, and they chose 2025. Again, remember, this was written up at the end of 2017. So they chose 2025 as being the date of the emergence of this new pandemic, sort of far enough in the future for various trends in both technology and socio-politics to have emerged, while still being close enough to the time frame in which it was written for them to have some sense of what was likely to emerge in that time frame. And then the second thing that they did was to consider the setting, if you like, the kind of socio-political setting in which this pandemic scenario was to play out. And they examined two dominant trends that were likely to influence the regulatory and public responses to future public health emergencies. One was the degree of access to information technology, and the second was how integrated or fragmented were populations likely to be along various lines: social, political, religious, ideological, and cultural. And in a slightly more detailed supporting document, which was actually published in the literature, they run through the four possible scenarios, the four possible socio-political settings that they considered. And one, the solitary confinement setting, was where there was uneven access to information technology. So some people were well connected to technology and some weren't. And people were also kind of, isolated from other communities. The UN Security Council model was where everyone had pretty even access to technology, but everyone was tolerant, and groups with different cultural and political and religious orientations were still having lots of communication with each other. And then the scenario that they describe in the Matrix is Shangri-La, but in the fuller description is Singapore, where there was peaceful coexistence of differently minded groups, but there were varying levels of access to information technology. And the echo chamber was the setting that they eventually selected, again, presumably based on their analysis of societal trends that prevailed at the end of 2017. And the echo chamber is where people are very much, plugged into that information matrix, and pretty much everyone from this is in the US, of course, so all strata of US society have pretty equal access to information technology, but they are very much in their own sort of bubbles. So people have selected the kinds of media that they expose themselves to. So both the traditional media sources and the social media environment that they immerse themselves in, so that they're kind of screening out messages that contradict what they already believe to be true. And they dubbed this the echo chamber. And again, just take a step back from this for a moment and consider the selection of the echo chamber setting as propaganda, and also potentially as predictive programming. From a propaganda angle, what we're looking at here is a group of people who are transmitting the idea to other public health risk communicators that what we can expect in the very near future is a very socially and politically and religious and ethnically fragmented society. And then from a predictive programming angle, it's almost like this document is a preparation for people involved in public health to actually expect this, for this whole situation to be effectively normalized in the relatively near future. So back to the scenario, and narrowing down to the angle of political leadership, they imagine an administration led by President Randall Archer. And it's not specified here, but it does become clear later on in the document that this Randall Archer is from the Democrat Party. and that he took office in January 2025, that he had served as vice president under a woman. So that would be the first female president of the United States who took office in 2020. In other words, what is being foreseen here is that President Trump would become only the 11th one-term president in the history of the United States. So Trump is the 45th US president. There have been only 10 one-term presidents before him. And again, this is really interesting from the propaganda and predictive programming angles, because at the time that this document was written, Trump was still extremely popular among his voter base. Now, whether you like Trump or don't like Trump is kind of immaterial here. In June of 2017, you can see from this article that Trump was still very, very popular among the working class whites who had formed his voter base. And so it's not really clear why these scenario planners saw it as being extremely likely that Trump would in fact be a one-term president, that he would be replaced by a female. Now, there's an interesting little twist here, and that in that the female president elected in 2020 stands aside in favor of her male vice president, and what we're actually seeing play out as the most likely scenario is the reverse situation, where Biden, assuming that he is confirmed as president, is extremely likely to step aside in favor of his female vice president. We'll see how that all plays out. This particular detail really struck me because it doesn't seem to add anything of use to public health officials to whom this document is directed at. There doesn't seem to be any value in this detail. It's not helpful to public health officials in terms of planning their response to have this. So why was it even in there? It's extremely intriguing. Raises a lot of questions. So again, just scrolling through some of the less interesting parts in which these are mocked up media reports, obviously just put together by graphic designers to illustrate what the media's response to the crisis might have been. And then we get to this very interesting phrase, the emergence of a novel coronavirus. And up until late 2019, early 2020, the term novel coronavirus was not in broad circulation at all. For most people, the particular phrase novel coronavirus, really the first time that it reached their ears was in late 2019, early 2020. And yet again, this particular phrase, novel coronavirus, was kind of seeded by this document written back in 2017. Again, what are we looking at here? Is this propaganda? Is it predictive programming? I'll leave you to ponder that for yourself, but it is a very particular phrase. Now, the scenario planners go on to talk about the initial response by the Centers for Disease Control and Prevention, which essentially are modelled on their approach to seasonal influenza, so maintaining hand hygiene and disinfecting contaminated surfaces and so on and so forth. And then the failure of these measures to actually contain the spread, and then the growing concern among Americans about the severity of this new virus and the illness that it was causing, and the fact that early on in the piece, physicians were only seeing the most severe cases who, unlike mild cases which just produce flu-like symptoms, cough, fever, headaches and malaise, the extremely severe cases resulted in pneumonia or hypoxia, requiring hospitalization, extensive medical treatment. Again, all of this is just sounding extremely familiar. And of course, we have seen exactly that same situation with SARS-CoV-2, where early on in the epidemic, the case fatality rate, that is the number of people who are identified as cases of infection of the virus who subsequently died, presumably as a direct result of that infection, was overestimated. So, early reports coming out of China indicated this very high case fatality rate of 17% early on, and then dropping down pretty rapidly, and of course lower in younger age groups and higher in older age groups, and so on and so forth. So and then of course subsequently in the pandemic, as more information comes in, case fatality rates actually get a lot more accurate. So the same situation as what we see in this projected scenario. And the initial estimated sparse case fatality rate of 4.7% is just eerily familiar. If my memory serves me correctly, the initial estimates for the SARS-CoV-2 case fatality rate were around 4.5% as issued by WHO. And then subsequently kind of downgraded, so that the CDC is now listing the case fatality rate as somewhere in the vicinity of 0.26%. Again, the virus that's imagined in the scenario has this extended incubation period, longer than the flu, and a latent period of 4 to 5 days, something that we have also seen put out there with respect to SARS-CoV-2, resulting in a situation where people infected with the virus could unknowingly be spreading it before they ever developed symptoms. Again, this is just eerily familiar. We've seen the same thing said about SARS-CoV-2, that pre-symptomatic or asymptomatic people are driving the spread of this virus and the disease associated with it, COVID-19. And this extended latency period is the primary rationale for control measures such as, universal community masking and social distancing. And of course, subsequently, we've seen that asymptomatic people are in fact not drivers of the disease at all. This is a very interesting study published in late November of 2020, in which close on 10 million people who are residents of Wuhan were tested using the PCR test. And it's a whole other story about whether we should be using this test, but they used this test to identify people who showed presence of the virus, or the fragments of it that are detected by the PCR test. And they identified 300 people who tested positive on the PCR but didn't have any symptoms, and then they contact traced them and found 1,174 close contacts, none of whom tested positive. They also found that out of over 34,000 people who had previously had COVID-19 and recovered, that 107 of them tested positive again. But again, they actually failed to infect anybody that they were in contact with. And so we're now in the situation where the WHO has acknowledged that the transmission of SARS-CoV-2 is via droplets and close contact with infected symptomatic cases. Okay, so people who actually do have symptoms, and that transmission occurs during close and prolonged contact, not while you're passing someone in the shopping centre, or when you're out on a walk, or riding your bike, or in your car, for instance. And I found this particular aspect of the WHO's document really interesting. So they reported on a study of transmission in Singapore, which involved extensive contact tracing, and found that this very low percentage of secondary cases resulted from pre-symptomatic transmission. So in other words, people who were going to go on to develop COVID-19, but at that stage were infected without any symptoms, were actually extremely unlikely to pass the virus on to anybody else. And that contrasted with a modelling study which estimated a much higher percentage, up to 44% of transmission may have occurred just before symptoms appeared. And they state it remains unclear why the magnitude of estimates from modelling studies differs from available empirical data. To which I think I have a very simple answer. The model is wrong. I mean, if you have empirical data, that is real world data that conflicts with your model, it's pretty good evidence that you should toss your model out, or at least update it so that it is more in line with the actual on the ground data. Now, at the end of each of these sections or chapters on various aspects of this projected scenario, there's a section called Food for Thought, in which the people, that is the public health communication risk professionals, are encouraged to reflect on what they've read and ask themselves questions and come up presumably with answers or responses. And this Food for Thought number 2 I thought was really, really interesting. What benefits does monitoring trends in social media postings confer on efforts to meet people's information needs during an evolving health crisis? In other words, the message that they're sending to the public health community is that they should be monitoring what people are saying on social media so that they can craft their responses. In other words, so that they can produce better propaganda. Well, that's my interpretation of it. Now we go on to the section in which they discuss possible treatments, and they put forward this theoretical drug, or this imaginary drug, Colosivir, an antiviral. So the description of Colosivir as having been initially deployed as a therapeutic for other coronavirus-related conditions and showing some evidence of efficacy against other coronaviruses really calls to mind remdesivir. It's pretty obviously the drug on which this imaginary drug Colosivir is modelled. And so we see this same pattern with remdesivir. So remdesivir originally developed for the treatment of Ebola virus, for which, by the way, it's not effective, but it inhibited the replication of a wide range of human and animal coronaviruses in vitro and in preclinical studies. So you can see that remdesivir is the model on which this Colosivir is based. And then they go on to talk about the development of a vaccine and the necessity to invoke the Public Readiness and Emergency Preparedness Act that provides liability protection to the company that is contracted to produce the vaccine. And we'll come back to that whole liability issue as we work our way through this scenario document. And it's noteworthy that this imagined vaccine was found to be effective at preventing coronavirus-related illnesses in various animals used for food, but it had some side effects, but the animals experiencing these side effects were immediately killed, and animals were typically slaughtered within a year of vaccination, so that information on the short and long-term effects of this vaccine, on which the vaccine that was contracted to be developed for humans was unavailable. So this leads on to questions in the Food for Thought section at the end of this chapter on the whole notion of developing an expedited vaccine. So, and all of these questions are worth pondering, again, from the point of view of this being both a propaganda document in itself, or that's certainly the way that I'm viewing this, but also as an instruction manual for the creation of propaganda by public health risk communicators. So let's go through these questions. How might federal health authorities avoid people possibly seeing an expedited, rushed, SPARS vaccine development and testing process as somehow rushed and inherently flawed, even though that process still meets the same safety and efficacy standards as any other vaccine? Now, I think you can look at this from a couple of different points of view. So if it is acknowledged that the long-term effects of this vaccine are unknown, which it was in the section just above, what does that say about the safety and efficacy standards of all the other vaccines, if they're basically saying it's pretty well equivalent? That's certainly something worth pondering, although perhaps not the thing that the authors of this document intended for you to ponder. But again, rather than the people who actually wrote this document grappling themselves with the question of, is it right, is it good, is it ethical to actually put a vaccine out there to the public that is intended to be taken by every man, woman and child in the country, when the fact is it isn't known what the long-term side effects of this vaccine will be. Like, that whole question is just swept under the rug. No, the question that they want public health people to consider is, how should we spin this? How should we talk to the public to allay their concerns? Well, hang on a minute, their concerns are actually very justified. But once again, we're reading a document that was written by people who don't consider that us, the general public, are actually bright enough to think through those issues for ourselves. Instead, we have to have our opinions shaped for us by those who are more expert than us. The second food for thought question is, how might federal health authorities respond to critics who propose that liability protection for SPARS vaccine manufacturers jeopardizes individual freedom and well-being? Again, my question would be, why don't we have a good think about whether this liability protection does jeopardize individual freedom and well-being, rather than just responding to critics? We need to think it through for ourselves. I found the mention of best practices principle of enabling people to make their own informed decisions about whether to accept the novel vaccine very noteworthy. I mean, I agree. The best practice is to enable people to make their own informed decisions. Now, what do people need in order to make their own informed decisions? They need accurate information, and there isn't any discussion information should be conveyed to the public in this document. Instead, their whole emphasis that taking up the vaccine is actually in their best interest. And this is not an informed decision. An informed decision in the case of uptake of a vaccine would be based on assessing several things. Firstly, what is the risk to the individual of contracting the virus? Secondly, what is the risk to them personally that if they contract that virus, that they will become seriously ill, require hospitalization or die? What is the risk of them suffering adverse reactions to the vaccine? There is another question which I suppose does need to be put on the table, which is, does the vaccine actually prevent them passing on the virus to other people? And as we've seen with SARS-CoV-2 vaccines, the CEO of Pfizer has actually publicly acknowledged that Pfizer doesn't know whether the vaccine prevents transmission. You know, he thinks that it would be a good idea for that to be studied, although he doesn't seem to have any sense of responsibility for his company actually doing that study. Apparently that should be publicly funded. And then, what are the potential consequences of health officials over-reassuring the public about the potential risks of a novel SPARS vaccine when long-term effects are not yet known? Again, I think this is really noteworthy because I don't think that the authors of this document are concerning themselves with the consequences for the public of taking up a novel vaccine whose long-term effects are not yet known. That's not what they're asking. What they're really concerned about is what might be the political fallout, what might be the fallout in relation to the public's level of trust in the pronouncements of public health officials if they pump a vaccine out there and it turns out that this vaccine actually has a lot of long-term risks. Now, they flick back to the whole Colosophy, this imaginary antiviral, and how it appeared to have a positive impact, but it had some nasty side effects, including stomach cramping, which is, by the way, one of the side effects of another antiviral drug, Tamiflu, which was kind of pumped out to the public in both the bird flu and swine flu pandemics, if you want to call them that, in the earlier years of the 21st century. And that the use of this antiviral drug did not actually prevent or reduce transmission of the disease, which is the case too with remdesivir. They talk about Colosivir being authorised under emergency use protocols as a treatment for SPAs. And again, if we compare this to remdesivir, remdesivir was actually granted emergency use authorisation for the treatment of both adults and children on the basis of studies, including one sponsored by NIAID, Anthony Fauci's agency, which found that the drug shortened the time that adults hospitalized for COVID-19 stayed in hospital. And then they go on to talk about the updating in the case fatality rate. So again, CDC downgrading its case fatality rate to a much lower one than the initial estimate. The exact same situation that we've seen with SARS-CoV-2. And they go on to talk about various problems that arise with public health messaging with, for instance, Native Americans and then more broadly with the public, when there's this viral video clip of a child suffering an adverse reaction to Colosivir, and this to me was highly reminiscent of the Tiffany Dover incident, this nurse who received her Pfizer COVID-19 vaccine on camera, and then 17 minutes later she fainted, and you can see the huge amount of activity of people making videos on Tiffany Dover. And so this whole situation that's outlined in the scenario, with this one video clip of a boy who starts projectile vomiting after taking a dose of the antiviral drug, you can see this being mirrored in the Tiffany Dover situation. And then as this imaginary viral pandemic goes on, as they say, public interest in the epidemic has begun to wane. And again, I mean, this has been mirrored in a very interesting way with respect to COVID-19, where North America and in Europe and in Australia, people kind of got less interested in it. Data began to emerge that indicated that the virus was not as deadly as people thought. People actually got to know others who'd suffered it and found out that most recovered and a few died, but of those who died, most of them were either extremely elderly or already sick with something else. And so the scenario writers talk about a situation in which the public is growing increasingly hostile toward continued SPAs messaging. Now, once again, remember that the purpose of this document is an instruction manual in creating propaganda. So they state, in order to overcome the public's disinterest, the CDC and FDA, in concert with other government agencies and their social media experts, began developing a new public health messaging campaign about SPAs, Colosivir, and the forthcoming vaccine Coravax. In other words, the purpose of the public health officials in doing this is actually to continue to fuel or to refuel the public's fear and their concern about a virus that they have become increasingly unconcerned about as they've become more familiar with it and its effects. That's interesting. Again, think about the parallels between this and what we've seen with SARS-CoV-2. So what is the government's rationale, or the public health community's rationale for keeping the fear of the virus going among the public? Well, the scenario planners state that it's because, yes, the disease is less fatal than initially thought, but it's still expensive to treat in its severe form. And even mild cases are having substantial impacts on economic productivity. So again, just flipping back to our current situation with SARS-CoV-2, there have been many doctors in the United States, in Europe, and here in Australia too, who have been coming forward and saying, do you know, there are nutraceuticals, things like vitamin D and quercetin and zinc, and there are cheap generic drugs with a very good safety profile drugs like ivermectin and, yes, hydroxychloroquine, which is in use throughout developing countries and apparently very effectively so. And so these doctors are saying, look, the whole reason why COVID-19 is expensive to treat is because we're waiting until people wind up in the hospital. So early treatment would actually significantly reduce the cost of treating this disease. And then when you look at the fact that remdesivir costs about $8,000 for a course because it requires a 5-day stay in hospital, and this has been anointed as the standard of care in the United States, you can see how this whole notion of expensive to treat is actually, in a sense, manufactured by the approach to treatment that has been taken, at least in rich Western countries. And then they talk about how the messages are created and approved by this cross-agency committee, and then they're shared across the internet, they're shared across social media accounts, and agency officials also recruit well-known scientists and celebrities and government officials and get them to make videos. And ZapQ is this imaginary social media platform that is developed in this scenario, and give interviews to major media outlets. They envisage getting the former president to BZ, a popular hip-hop star, and Paul Farmer, co-founder of Partners in Health and a renowned global health expert. And I wonder whom he is based on. Let's just have a think about who this Paul Farmer, a renowned global health expert, who he might be modeled on. All right. And then they go on to discuss, some of the disasters that happen with this social media campaign, where this hip hop artist makes a bit of a foot in mouth comment about the volunteers participating in the vaccine trials being comparable to men who volunteered at Tuskegee. Tuskegee, of course, being the notorious experiment, a highly unethical experiment in which poor illiterate black sharecroppers in the American South were recruited without their consent into a study aimed at documenting the so-called natural history of syphilis. In other words, what happened when people infected with syphilis remained untreated. And this experiment continued long after an effective treatment for syphilis was developed, and the so-called participants in this study were not given this treatment. Instead, they were left to develop full-blown syphilis and, of course, to pass it on to their wives and children, which was catastrophic. There is a mention of students, so college or university students, who are upset because of what they consider to be unequal access to medical care for this illness. So again, it's almost like a forecasting of the sudden emergence of the Black Lives Matter movement and the emphasis placed on structural racial inequality in the United States. And then more on Colosivir turning out to be ineffective, less effective than initially thought, about on par with other antivirals, all of which showed less efficacy. Again, we see exactly the same thing happening, in real life with remdesivir, where the WHO's Solidarity trial found that remdesivir had little or no effect on either death or duration of hospital stay. So again, what have we got here? Is this life imitating art? Is this predictive programming? Is this just a game plan that's written out in advance and then followed? Who knows? I will leave you to come to your own conclusions as you ponder all of this. And then looking at question 2 in the food for thought questions. This one is well worth paying attention to. In light of waning public health confidence in official statements about antiviral risks and benefits, how should health authorities best lay the groundwork for the release of the novel Coronavax vaccine? In other words, again, this is not about whether the public should be given accurate information. It's more, how can we do effective damage control when the public has become very dubious about the messaging that's put out to them by public health officials and other arms of government, so that we can, overcome resistance and get them to accept the vaccine. Now, in the next section, they talk about what is likely to happen when there are initially limited supplies of the vaccine, and people who aren't included in the initial priority groups get upset. One thing that I did find kind of funny, really, was that in the scenario, they envisaged that healthcare workers are not included as an initial priority group, and that they get pretty upset about that, and some of them refuse to show up for work. Well, in a case of life not imitating art, what we're actually seeing is an extremely high degree of skepticism about the vaccine, where nurses are saying, actually we don't want it. That's happening in the UK as well. New York City firefighters, more than half of them are saying that they don't want to be vaccinated. I thought this particular article in the New York Post was worth spending a little bit of time on, because in itself, of course, it is a piece of propaganda. So it reports on the results of this survey of New York City firefighters, and then goes on to in effect editorialize and propagandize by describing the shot as potentially life-saving. Well, actually, we don't have any data at all to support that, because the clinical trials conducted by the vaccine manufacturers did not actually test either hospitalization or death as outcomes of interest in determining the efficacy of the vaccine. The fact that the firefighters didn't actually want the vaccine, or over half of them didn't, was described as a stunning anti-vax response, as opposed to a bunch of people saying, yeah, someone else can go first, which seems actually pretty rational to me. And again, a piece of propaganda here. Thousands of New York City's first responders and other essential frontline workers would continue to be vulnerable to the virus and remain potential spreaders. And again, the CEO of Pfizer has acknowledged that the company does not, in fact, know whether the vaccine that they've developed prevents people who are infected with SARS-CoV-2 from spreading the virus. So it's very interesting that the author of this article in the New York Post considers him, or herself, qualified to state that these firefighters who don't receive the vaccine are going to be potential spreaders. And of course, potential spreaders, that is a phrase that is really intended to incite fear in the public, so that if they get into an emergency situation and a firefighter comes to their aid, the public is going to be afraid, like, is this firefighter vaccinated? Am I going to potentially get the virus from this firefighter? And just bear in mind that firefighters in the US are also frequently called to situations where, for instance, a person requires resuscitation. So they're not just firefighters, they're first responders in the more broad sense of the word. How the scenario planners talk about the potential trouble that could arise from the US government's decision to access patients' electronic health records to determine the number of individuals in high-risk populations receiving care in particular areas. In other words, the accessing of private information, confidential and sensitive health-related information, to identify target populations for the initial round of vaccination. And again, this brought to my mind the deployment in the COVID-19 situation of Palantir, this extremely controversial software which has been previously used to identify target populations activities. So as Whitney Webb and Jeffrey Lafredo write in this excellent article, the same national security state that Palantir has long aided in oppressing countries abroad and minorities domestically is now running Operation Warp Speed, the expedited COVID-19 vaccine development scheme, while Palantir's selection to manage the allocation of the vaccine to priority groups may just seem like the national security state wanting to award the contract to a familiar and trusted company. The allocation strategy's heavy focus on vaccinating minorities first, with questionable justification for doing so, suggests something else may have been behind Palantir's selection to play a prominent role in warp speed. And again, this company has been using its software in the past to identify and prioritize minority groups and targeting them on behalf of law enforcement agencies of the United States. But again, rather than really raising ethical questions about the use of electronic health records or any other way of targeting priority populations, the scenario planners talk about the importance of active monitoring of the information sea in which the public is swimming, so that authorities can create conditions and provide information that support recommended public health behaviours. So again, there's no consideration of the ethics of government using whatever means to identify priority populations for this. The role of the scenario planners is to help public health risk communicators to develop better propaganda to overcome the public's objections. Now, the next situation that they talk about is a possible power outage. So they envisage the power grid going down and cutting out power in numerous US states and British Columbia in Canada, and how this interferes with the vaccine rollout, because all communication about the rollout had been published in electronic form. And so this kind of made me giggle and wonder whether this is, some kind of warning to Klaus Schwab and his cohorts at the World Economic Forum, that it might be a good idea to sort of hold off on the full-scale cyber attack that they are warning against, planning for, laying the groundwork for, until the vaccine rollout is complete. Let's hear a little from Klaus Schwab himself.
We all know, but still pay insufficient attention to the frightening scenario of a comprehensive cyber attack, which would bring to a complete halt to the power supply, transportation, hospital services, our society as a whole. The COVID-19 crisis would be seen in this respect as a small disturbance in comparison to a major cyber attack.
So yes, Klaus, hot tip from the scenario planners: if you're going to bring down the power grid, at least wait until the vaccine rollout is completed. Good idea. Now, one situation that the scenario planners are really concerned about is what they describe as anti-vaccination groups. And they talk about various groups that are opposed to this imaginary Coronavax vaccine for various different reasons. And they express great concern about how media savvy they are and how they're using multiple platforms to spread their messages, and how they have constructed their own media environment so that they're not exposed to pro-vaccine propaganda. And I love the way that they put propaganda in inverted commas, as if anything that comes from pharmaceutical companies or the government or public health or medical authorities is not actually propaganda, it's propaganda. Okay, so I thought that was really, really telling. It's kind of like, what we do isn't propaganda, it's public health messaging. What those anti-vaxxers talk about, now that's propaganda. They talk about the anti-vaccination movement mobilizing resources and spreading the message that Coronavax was inadequately tested and had unknown long-term side effects, which they in fact acknowledge at various points in this scenario, that it does have unknown long-term side effects. But apparently when people who are so-called anti-vaccinationists talk about that, that is propaganda and therefore not to be believed. There's a very interesting kind of presaging of Black Lives Matter. Again, this document was written in 2017, so obviously long before the Black Lives Matter movement rose to really public, national and international prominence after the death of George Floyd. Extremely interesting. Very, very interesting, the weaving through this scenario of so many themes and motives and events that we've actually seen come to pass. They foreshadow the opposition of African Americans to the vaccine, and again, I mean, this is extremely interesting because we are seeing exactly that situation where African Americans are far less enthusiastic about receiving the vaccine, with only 20% reporting that they would get the vaccine soon, over half of them intending to wait, and in another survey, black people being far less likely than white people to accept the vaccine. And then we see this character Paul Farmer popping up again. So Paul Farmer, the renowned global health expert, who is most definitely not based on Bill Gates. And so he's trotted out to laud the safety and efficacy of the vaccine and emphasize the danger of the disease and express regret that the vaccine can't be made available to everyone on the planet. Again, I mean, who have we heard telling us that life can only go back to normal when everyone on the planet has been vaccinated against SARS-CoV-2? One of the questions for consideration at the end of this chapter is what communication strategies might be effective for breaking into and engaging with otherwise self-isolating groups who oppose a recommended medical countermeasure like Corovax, and might be placing themselves and others at risk during the outbreak. And this brings to mind the article that I covered in my previous video by Cass Sunstein on his notion that the best response consists in cognitive infiltration of extremist groups. In other words, infiltrating online or in-person groups such as anti-vaccination groups to undermine them. And then there's this interesting scenario where college students kind of boycott the vaccine, saying that they don't want to take it up until everyone in the world is able to get access, including people in poor countries. And the scenario planners envisage them kind of joining forces with this Paul Farmer, who is not Bill Gates, and essentially utilizing this coalition to push the idea that less developed countries should also be receiving this vaccine. And this, of course, facilitates the WHO recruiting extra financial support from the United States and other countries in order to purchase more doses of this vaccine and distribute them to developing countries. What's not mentioned in the scenario, of course, is that this results in greatly expanded profits for the pharmaceutical companies, because they can now get their wares into poorer countries which would probably not be able to purchase their vaccines on their own behalf. But again, these considerations of who's financially benefiting are not even on the table from the point of view of the people writing this scenario. The water in which they're swimming, to borrow from Marshall McLuhan's analogy, is the notion that vaccines are good and they're the only answer to pandemics and everyone should have them, and it's the role of people like themselves to ensure that as many people in the public take up these vaccines as is humanly possible. Further on in the scenario, we come to the section where the US government begins aggressively targeting its pro-vaccination efforts to demographic groups who have low uptake of the vaccine. And so they provide targeted internet advertisements to individuals. So if they conduct web searches or visit anti-vaccination websites, they're going to be exposed to internet advertising. So if someone searched Google for coronavirus side effects, for example, an advertisement pops up explaining the benefits of the vaccine. Now, I've not used Google as my search engine for quite some time, but reading this prompted me to see what would happen when I typed Pfizer COVID-19 vaccine side effects into Google. And here it is. So they mention these sort of reasonably minor side effects of the vaccine. In the common questions section, they talk about the symptoms like fever being normal and a sign that the body is building immunity. In other words, the answers that people get when they search for side effects are essentially telling them not to worry. It's a pat on the head. Don't you concern yourself with that. If you feel really ill after the vaccine, it's not because it's doing anything bad to you, it's because it's actually working. The question, what is the effectiveness of the COVID-19 vaccine developed by Pfizer, is answered by essentially information from Pfizer, which is that it's 94% effective in preventing infection. And again, the public's not had access to those clinical trial data. So this is essentially science by press release. The scenario planners talk about a potential response to people who search for this colossal vomiting video on YouTube. And I would interpret this as proposed response to this is that people who search for this would first have to watch either a montage of pictures illustrating the effects of spas. In other words, their solution to people wanting to watch a toddler vomit on YouTube would be, we're going to make them watch people who are seriously ill, like, coughing their guts up or lying in a hospital bed, intubated and gasping for breath. Or, and this is truly scary, a clip of Paul Farmer's explanation of Coravax's benefits. I mean, thank God, when we're searching for side effects of the Pfizer vaccine, we don't yet have a video of Bill Gates telling us how wonderful the vaccine is. But maybe that's coming. They talk about how this advertisement campaign required government officials to leverage relationships in the information technology industry, including the many companies involved with social media. But the impact was worth the effort. And haven't we seen that come to pass, where YouTube is censoring videos and deleting the accounts of people who dare to question the safety or the efficacy of the vaccine or the basis in science of any of the public health measures that have been instituted to control SARS-CoV-2. We see Facebook having agreed to actually boot anyone off Facebook who is raising questions about vaccination and refusing to accept advertising from anyone who wants to run an ad questioning vaccination. We see Twitter deleting accounts, so the impact was worth the effort. Oh yes, it certainly has been. And then going on to the questions or the communication dilemmas at the end of this section, we have this question: why were partnerships between the federal government and the information technology industry, including a number of social media companies, so vital to increase overall uptake of the Coravax vaccine? And again, I invite you to consider this question in the light of this document as both an instance of propaganda and an instruction manual in creating propaganda, and as an example of predictive programming. Next up, there's a discussion of the side effects that result from the vaccine. So neurological symptoms, very reminiscent of the aftermath of the pandemrix vaccination, which resulted in numerous cases of narcolepsy in children in particular, but also some adults who received this particular vaccine. They talk about lawsuits being filed by parents of children who developed mental retardation when they got encephalitis after receiving the vaccine. So these parents in this scenario sue the federal government. They demand removal of the liability shield that protects the pharmaceutical companies who developed and manufactured the vaccine. And then they go on to describe how these parents withdrew their suit when they learned that the National Vaccine Injury Compensation Trust Fund and an emergency appropriation of funds authorised by Congress under the PrEP Act existed to provide financial reimbursement to those who were adversely affected by the Coravax vaccine. Now, this National Vaccine Injury Compensation Trust Fund, that is a thing. The National Vaccine Injury Compensation Trust Fund was set up in the wake of the 1986 Act, which excluded vaccine manufacturers in the US from any product liability, so that anyone who was injured or anyone who died as a result of receiving a vaccine on the CDC-approved schedule would receive, or their family would receive, compensation through this trust fund. And it's paid out somewhere in the order of $4.2 billion since the scheme began in 1988. However, the COVID-19 vaccines will not actually be covered by that scheme. And so this multi-billion-dollar federal program to cover people injured by vaccines is not going to cover COVID-19 vaccine injuries. And this article was published in September of 2020. And the Department of Health and Human Services was pushing to keep any new vaccines out of the program. And subsequent updates to that story showed that, yes, in fact, the COVID-19 vaccines have been excluded from that compensation scheme and will be pushed off into the Countermeasures Injury Compensation Program, which is a much smaller scheme and has at this stage no funding to pay out any claims that result from people filing suit against the government because they were vaccine injured by COVID-19 vaccine. And the Countermeasures Injury Compensation Program has a history of seldom paying claims. They have a much lower cap on benefits, and they don't pay for pain and suffering. They pay fewer than 1 in 10 claims. There is a very short, if you like, statute of limitations. You have to file a claim within a year of getting a vaccine, and so if you develop a very long-term side effect of getting the vaccine, too bad. You're not actually going to be able to get any compensation. The program doesn't pay legal fees, doesn't pay for expert witnesses, doesn't pay for damages, so things like lost income, for instance. The scenario planners envisage particular concern among African American parents who continue to question the government's motives regarding the Coronavax vaccination campaign. And again, this is mirrored in the COVID-19 situation where concern or flat-out opposition to the vaccine is extremely strong in African Americans. The scenario document wraps up with essentially an instruction manual for how government can better manage growing negative public opinion regarding the vaccine and the government's perceived indifference to victims of the public health response to SPARS. So again, remember that this is a document that is written to help public health risk communicators instruct their political masters in how to play the game better, how to more effectively propagandize the public. And one of the ways to do this is to acknowledge the public's suffering, the sense of vulnerability that the people experienced during the pandemic, the strength that the public exhibited under threat of great danger, and also publicly acknowledging the broad willingness among people to accept a prescribed countermeasure, the vaccine, that promised to end the pandemic. So, in other words, this is a way of essentially buying off the public. So just tell them that they've been very good boys and girls, and we really appreciate how well you've cooperated with us, your overlords. Oh, sorry, I meant to say your elected government. So the primary message that should be conveyed is one of gratitude to the American public for remaining strong during the pandemic. So again, we're reframing this whole reorganization of society that people have gone along with as strength. Part of that would be conveying appreciation for adhering to public health recommendations, including vaccination. Again, pat on the head, good boys and girls for doing as you're told. And then in the final section, they talk about the aftermath of the pandemic and accusations that influential politicians and agency representatives sensationalize the severity of the event for perceived political gain. An interesting presaging of the current situation. They talk about conspiracy theories proliferating across social media, suggesting that the virus had been purposely created and introduced to the population by drug companies, or that it had escaped from a government lab secretly testing bioweapons. And their only mistake in this was that they talked about this happening in the aftermath of the pandemic, whereas we saw speculation that SARS-CoV-2 was a bioweapon very early on in the piece with COVID-19. So let's loop back around to where we started with, thinking about this particular document as a piece of propaganda. And we'll reacquaint ourselves with Edward Bernays' statement about propaganda, the conscious and intelligent manipulation of the organized habits and opinions of the masses. And I would really argue that that's what we're seeing in this particular document. It is an attempt to manipulate consciously. Now, I'll leave it up to you whether you think this is an intelligent manipulation, but this is a very clear attempt on the part of the scenario planners to help those who they describe as public health risk communicators to more effectively manipulate the public, their habits and their opinions. There's a very chilling statement by Bernays in which he describes the fact that we are dominated by the relatively small number of persons who understand the mental processes and social patterns of the masses. It is they who pull the wires which control the public mind, who harness old social forces and contrive new ways to bind and guide the world. So what I'm inviting you to do is to ask yourself, is this the world that you want to live in? Is this the way that you see yourself as essentially someone who needs to have their wires pulled by people that you've never met, who owe allegiances perhaps to people or to corporations or to organizations that you don't necessarily support the aims of? And if that's not how you want to live and how you want to see yourself, then I challenge you to get yourself informed. Go through the source list, download this document, read it for yourself, read it in its entirety, and reflect on it. I would love you to put your comments in the comments section below and tell me, what you think about this. Do you think I'm on target or off base in describing this as both a piece of propaganda in itself and a propaganda creation instruction manual? What do you think of the predictive programming angle of this? I really look forward to interacting with you. And again, please let me know if you would like to see more of these deep dives on key documents, and feel free to send to me any documents that you think are worth my while doing a deep dive on. And I look forward to talking to you again soon.